As we go through the presentation for the state's 1332 waiver application, you will note that we do have a set time frame of 30 days for formal public comments. You will also have an opportunity to provide public comments today during the meeting, but we just ask that you please hold all comments and questions until the public comment portion of the presentation. And with that, we'll go ahead and get started. Next slide, please. The division will be hosting 2 public meetings to engage stakeholders on the state's 1332 waiver application. One of those is today, and the second will be held on December 5th from 1 to 3 p.m. Per state law, the state's 1332 waiver application must be submitted to the federal government for approval no later than January 1st of 2024. This waiver seeks federal approval for Nevada to receive the savings to the federal government from Nevada's implementation of a new state contracted health insurance options and a reinsurance program to both establish and finance a market stabilization program. Today, we will be providing an overview of the battle-born state plans and the market stabilization program, provide an opportunity for questions and public comment, and then give an overview on the next steps in the state's waiver application process. Next slide, please. This same state law requiring Nevada to submit the 1332 waiver application also requires the director of the Department of Health and Human Services to contract with health carriers to offer new health insurance options.
Can you please mute yourself? We're getting someone's talking. Thank you. Sorry. Thanks.
Thank you. So those new options will be referred to as the battle-born state plans, or the BBSPs. These new health insurance options of the BBSPs must be available to consumers who shop for health insurance in the state's health insurance exchange, otherwise known as the Nevada Health Link, beginning January 1st of 2026. The battle-born state plan options will, for the most part, mirror other plans in the Nevada Health Link, with one exception. The BBSPs must meet an annual premium reduction target and pay their provider networks rates that are at or above Medicare rates. With that, I will hand it off to Michael Gordon to give an overview of the Market Stabilization Program.
Okay, good afternoon, everyone. Thank you, Melinda. And continuing on what Melinda was explaining, the second key initiative is a Market Stabilization Program. The waiver proposes to use federal savings from the BBSPs to finance this program. So there are key goals for this, and that's 1, to mitigate the potential risk of the new premium reduction targets on health carriers and their provider networks. 2, to reward health carriers and their provider networks if they improve health outcomes and quality of care. And 3, to ensure market stability in Nevada's individual health insurance market with the introduction of the new health insurance option and reforms. Continuing on, to achieve these goals, the governor has outlined 3 new initiatives. 1, a state-based reinsurance program, which is at no cost to the state, that is aimed at alleviating any unexpected financial risk to participating carriers and their provider networks with the introduction of the BBSPS. 2, a quality incentive payment program to reward high-performing health carriers and their provider networks. And 3, a Practice in Nevada program to provide incentives for more providers to live and practice in Nevada, especially in rural regions of the state. These programs, if approved, would begin in plan year 2027 after the state receives its first year of federal savings under the waiver from plan year 2026. There are some statutory requirements for BBSPs. State law requires that the director to contract with health carriers to offer the new battle-born state plans and use the director's Medicaid contracting authority to enforce certain state requirements. Participating carriers must offer these new plans through the Nevada Health Link and meet all federal and state standards for qualified health plans under the Affordable Care Act. They also have to offer at least 1 silver and 1 gold battle-born state plan. They must offer plans that will meet certain premium reduction targets which will increase gradually to at least 15% over the first 4 years. And last, pay provider rates that are no lower than Medicare rates. And now I'll hand it over to our administrator, Stacy Weeks.
Thank you, Michael. Good afternoon. So the next slide, we're going to talk a little bit about the state procurement process. So under state law, the director must implement a new procurement process to establish the new contracts with health carriers for the battle-born state plans. This creates a state-private model for operating the new health plans. This procurement must take place under state law at the same time as the state's next Medicaid managed care procurement, which is slated for no later than January 1, 2025. Any health carriers seeking to participate in the state's Medicaid managed care program must also offer and submit a good faith bid to also contract with the state to offer and administer the new battle-born state plans in the exchange. The division will use the new contract as its tool to enforce the statutory requirements for the battle-born state plans, including the premium reduction target, similar to how it uses its Medicaid managed care contracts. Currently, the division contracts with 4 health carriers for its Medicaid managed care program. These are Anthem, Health Plan of Nevada, Silver Summit, and Molina. Next, okay. So the design, this slide here is intended to kind of give an overview of the design and to try to explain all the requirements that apply to the battle-born state plans as they relate to other plans in the individual market. I just wanted to note that this is a non-group plan. We are not offering a small group plan, even though that is permissible under state law. The battle-born state plans will need to comply with the existing non-group and qualified health plan rules, as you can see here in the gray arrow in that box. They have to meet state network adequacy requirements, state solvency standards. They have to go through the state review process for the premium rates. They have, of course, in the non-group, if they were outside the exchange, they would not have to participate in the metal tiers. We'll talk about that in a minute. And they have to be available to be direct purchase from the carrier. They have to meet under the law also QHP standards, which apply to the individual market plans if they are offered through the exchange. QHP stands for Qualified Health Plan. They have to meet all of the Affordable Care Act standards. They have to have the essential benefit set. They have to meet all consumer protections that apply to the qualified health plans, as well as be certified by our exchange and be offered on the exchange. They have to also pay the carrier fee like they do for all their other products that they're offered on the exchange. They have to meet the metal tier requirements and all the standards regarding those products. And they have to be purchased, like I said earlier, from the carrier on the exchange. And then the BBPSPs have additional set of requirements that are in that blue box, right? These do not apply to other individual market plans, but will apply to the battle-born state plans under the contracts and state law. They have to meet the premium reduction target. They also have to have a minimum provider rate floor. They cannot, like Michael said earlier, they cannot go below Medicare rates. They also have to meet any other contract requirements that we set forth in the Medicaid agency for these products, including alignment between, where feasible, between networks. They also have to have silver and gold tiers, which we mentioned earlier. They have to offer at least those 2 products in the exchange. And they have to be, again, available on the exchange as well as direct purchase from the carrier. So as you can see there, that kind of hopefully gives a nice visual. Next slide, please. There are a couple other requirements that will apply to these products that we wanted to mention that affect the providers, especially as well as the consumers. A provider under contract today with the state as a network provider and other state contracted health insurance programs must participate as an in-network provider in at least one network with one carrier that's offering the battle-born state plan. This includes our public employee benefit program and our state workers' comp program. These providers must also apply policies to accept new patients enrolled in the battle-born state plans to the same extent as that provider accepts any other new patients enrolled in other private health insurance plans to avoid discrimination. State law requires a director to promote in its contracting process strategies with health carriers that will better align networks between Medicaid and the individual market, address health disparities in the individual market, improve cultural competency in the provider workforce, and increase the use of value-based payment models with providers, as well as address the gaps in Nevada's healthcare workforce. Next slide, please. All right, so in the waiver application, you will also find the actuarial study that goes along with the waiver application that we'll be submitting to CMS on January 1, 2024. And from that study, some of the highlights of those findings are here on this slide. The 1332 waiver is expected to lower premiums and generate savings for the federal government due to the lower premium tax credits that are in exchange due to the lower premium rates. Nevada can bring home these savings to fund other state-based programs that strengthen the health insurance market and access to care. The 1332 waiver is expected to achieve, according to the actuarial study, an estimated $279 million in federal savings in the first 5 years and $760 million at the end of the first 10. Their new reinsurance program is anticipated to relieve pressure on health carriers and their provider networks by nearly half once it's up and running. So some of that savings, just to be clear, comes from not only the premium reduction target, but also the reinsurance program, which will apply to the entire individual market and all carriers that participate in the individual market. On the side there, you can see our timeline. We are at the number 3 bucket of 7. We are in the public workshop stage and tribal consultation. We'll be submitting for federal submission, and then completeness review will be conducted by CMS, along with a 30-day public comment period. CMS then will have negotiations and we'll have a federal decision, and we'll have an update on the waiver at that point. I will now turn it over to Michael and Melinda for the public comment period.
Thank you, Stacy. So now we'd like to open it up for public comment. So if you are joining us online, if you could please raise your hand, use the raise hand feature, and we can call on you that way. Or if you're in person, please feel free to raise your hand, and we'll go ahead and take public comment. So first, do we have any public comment in person first? Okay. We'll go to online. Okay, so I have Lisa Lynn Chapman. Please go ahead.
Good afternoon and thank you. My name is Lisa Lynn Chapman and I'm a private citizen. Thank you for holding these hearings. For decades, wealthy insurance companies have raised health insurance rates and profited at the expense of hardworking Nevadans. Thankfully, during the 2021 legislative session, Nevada passed Senate Bill 420 by Senator Nicole Cannizzaro, a public option health insurance that requires insurance companies to provide quality health insurance at a lower rate to Nevadans. The public option isn't made up of junk insurance plans that won't cover anything. Instead, it meets all federal and state requirements like preventative screenings, vaccines, birth control, and reproductive care. This opens up an amazing opportunity for community members to have more freedom and access when choosing a health insurance plan that best fits themselves and their families, which Nevada desperately needs. Currently, 11.6 Nevadans are not covered by public or private insurance. This ranks Nevada at the bottom 10 states for health insurance coverage. The public option will provide an affordable option for those not eligible for public insurance like Medicaid or Medicare, those employers who don't provide insurance, and for those who are self-employed. Unfortunately, we know that the insurance industry has gouged Nevada families for decades and isn't happy about this and will use every scare tactic in the book to try and kill the public option. Please don't let them. For someone like me, who has several health concerns, including diabetes and psoriatic arthritis, I have been unable to leave jobs because I could not afford health insurance and was unable to take jobs without health insurance. This is a problem facing numerous Nevadans as they struggle with health issues and the lack of available and affordable health insurance options. The public option will allow me and others more flexibility in employment, including working in the gig economy like many other Nevadans. No one should be forced to stay at an employer just because they can't afford private insurance. The public options will allow Nevadans more freedom and autonomy in their healthcare decisions. And with the approval of the 1332 waiver, Nevada will be able to reinvest in things like healthcare provider development and payment systems that focus on quality of coverage and not how many services you use. This means people like me will not only have coverage, but be able to see a doctor when we need them, something that is currently a problem regardless of insurance status because of our long-standing provider shortage. And know that my treatments will be better tailored to me when I do better and I'm healthier. Providers get paid more. Nevada's public option insurance is governing at its best because it prioritizes the needs of community members. It provides an option for hardworking Nevadans to access affordable health care and giving them more freedom to make decisions that will improve their lives. Thank you very much for hearing me.
Thank you, Lisa. Appreciate your comments. Next, we have Adam Zarin. Please go ahead.
Great, thank you. I'm Adam Zarin, that's Z-A-R-R-I-N, and I'm the Director of State Government Affairs for the Leukemia and Lymphoma Society. Our mission is to cure blood cancers and improve the quality of life for our patients and their families. This past month, LLS and our partners at the American Cancer Society, Cancer Action Network, and RP Medical Debt commissioned a survey of Americans nationwide. The poll conducted by Periandum Research asked about how Americans afford their health care. And this is what we learned. Americans nationwide, including in Nevada, feel trapped by their medical debt. Nearly 7 in 10 U.S. adults say they are concerned about affording their health care. Many say they delay care, skip appointments, or change the foods they eat because of medical debt. Nearly 7 in 10 U.S. adults receive medical bills they cannot afford. So they delay paying those bills, they put it on a credit card, or challenge the bill altogether. 6 in 10 say they worry about incurring debt when they receive medical care. And while medical debt impacts all, it harms some communities more. Certain groups are more affected by medical debt and less aware of their options to deal with it, like those who are uninsured, younger consumers ages 18 to 34, pre-retirement consumers ages 50 to 64, those who live in rural communities and communities of color, particularly Native American individuals. So why am I telling you about medical debt today? Access to affordable and high-quality insurance is a necessary safety net to preventing medical debt. A blood cancer diagnosis often brings extraordinary financial pressure during and after treatment. A patient will rack up insurance premiums, co-pays, co-insurances, travel, and other out-of-pocket costs. In the 3 years following a blood cancer diagnosis, patients' out-of-pocket spending ranged anywhere from $7,800 to $9,127. A patient's out-of-pocket spending never returns to pre-diagnosis levels. This means that the burden of medical debt continues beyond diagnosis and treatment. That is why the public option is foundational to improving access to affordable healthcare for Nevadans. We know it will reduce premiums, we know it will make coverage more affordable, and we know it will save the state more money. We encourage the department to focus on individuals and their experiences with the healthcare system, and we need to improve access and affordability to prevent more families from being trapped by medical debt. Thank you, and I appreciate your consideration.
Thank you, Zarin. Appreciate your comments. Next, we have Patrick Kelly. Please go ahead.
Good afternoon. My name's Patrick Kelly. I'm the CEO of the Nevada Hospital Association. We've long supported better access to health insurance for those Nevadans who are currently ineligible for existing forms of health insurance coverage. We applaud the administration's creative approach to stabilizing the health insurance market through a reinsurance program. However, we still believe the public option program presents significant risks, and these risks must be addressed to assure a quality healthcare delivery system in our state. We all know Nevada has a very fragile healthcare delivery system. The public option program has the potential to exacerbate two of our biggest problems: health professional shortages and cost shifting. 3 items must be addressed to avoid destabilizing our system. First, premium reductions of 15% in the first 4 years are substantial. Insurance companies will struggle to meet this requirement. Without some type of relief for the insurance companies, Patients and healthcare providers will bear the cost of the premium reductions. Patients will experience coverage denials, and providers will receive low reimbursement rates. Second, the law provides that providers must be reimbursed at minimum at Medicare rates. Our efforts to recruit desperately needed healthcare professionals will be for naught if providers are paid at or just a little above Medicare. Medicare rates are not sufficient to incentivize providers to participate in the program. The incentives provided to insurers under the reinsurance program must encourage them to offer reimbursement rates that are comparable to the self-insured and commercial markets. Additionally, low Medicare rates will contribute to our cost shift problem. Nevadans with commercial insurance will be asked to subsidize more health care costs because of the low reimbursement rates under the public option. Third, limitations must be established on who can enroll in the public option program. People who are eligible for an existing health insurance program should not be permitted to enroll in the public option. Without limitations, the equation is simple. The more Nevadans who enroll in the public option, the greater the cost shift to Nevadans who maintain commercial health insurance. Eventually, commercial health insurance will become unaffordable. More people will move to the public option because it's cheaper. Commercial insurance will evaporate, and providers will leave the state because reimbursement is inadequate. In this application for a 1332 waiver, we hope these risks will be addressed and the focus will be placed on providing health insurance to those Nevadans who need it most. Thank you.
Thank you for your comments. Next, we have Shelby Parks. Please go ahead.
Thank you for holding these hearings. I'm Shelby Parks, the Community Engagement Director at One API Nevada. We're a nonprofit that advocates for the Asian and Pacific Islander community in Nevada. And in this role, I have encountered many cases where community members face financial strain due to high cost of medical bills, forcing Nevadans to forego essential treatments or preventative care. I was given testimony from Nevadans on their experiences with healthcare access in Nevada and how the high costs have been a significant barriers to preventing them from seeking care or obtaining comprehensive coverage. Jillian Gilbert in Reno, Nevada says, as someone who struggles with chronic illness, I need access to medical care often that I can't afford without health insurance. High health insurance prices are a burden and a barrier to accessing the care I need as a recent college graduate. I support the public option to create more reasonably priced health insurance plans so people like me can access the care they need. Lorenzita Santos in Las Vegas, Nevada says, my father, grappling with diabetes for most of his life, bore the weight of healthcare expenses, particularly during the 2008 recession when he juggled 3 jobs to cover groceries, our home, and insulin. In the midst of challenges, the public option emerges as a vital step forward by offering reasonably priced plans with sufficient coverage. It signifies a positive shift towards protecting families and immigrants communities like ours. Keeping insurance costs low becomes a lifeline for those navigating the complexities of healthcare and affordability. Nevada's high uninsured rate, particularly within the AAPI community, underscores the urgency for solutions like the public option. Over 340,000 Nevadans, including a significant AAPI population, grapple with being uninsured. The public option is more than a policy shift. It's a promise to safeguard the health and well-being of families like mine. And I'll close by saying Nevada's public option promotes affordability by leveraging our tax dollars to benefit Nevada consumers. The approval of the waiver and funding for healthcare workforce development are paramount. The scarcity of providers in Nevada limits access and care and contributes to escalating costs. By investing in workforce development, we not only address the shortage of healthcare professionals, but also pave the way for more competitive healthcare landscape in Nevada. Thank you.
Thank you for your comments. Next, I have Daphne. Please go ahead.
Thank you. Can you hear me?
Yes, we can. Thank you.
Okay. Thank you so much. My name is Daphne Moore. I am a member of the NAACP Las Vegas branch. I'm calling to express our branch's support in the implementation of creating the State Health Exchange. We're grateful for the Senate Majority Leader Canizaro for keeping the process of implementation moving forward. The state-based health exchange is an urgent and necessary investment in all Nevadans to make quality, affordable healthcare more accessible, especially on the heels of a global pandemic. Attempts to slow walk implementation of a means to derail the process will have detrimental impact on our communities. And the branch members of the Las Vegas NAACP are watching closely. We won't allow this important investment in our communities to be sidelined by special interest groups or partnerships. Let's get this done. Thank you.
Thank you for your comments. Next, I show Michelle Craig. Please go ahead.
Hi, my name is Michelle Krieg, and I'm a Reno, Nevada resident. In January of this year, I was diagnosed with an early stage of cervical cancer, and I had to undergo a number of procedures and tests before needing a full hysterectomy. At the time, I was on a high deductible plan through my husband's work, but a month before my hysterectomy, his company that he worked at for 10 years laid him off and closed their business. We then had to go through COBRA for our insurance. And on one hand, we were grateful for the COBRA option, but on the other hand, it meant that our premiums now doubled in cost at a time where we were already financially stressed and mentally stressed due to the layoff and the healthcare condition I was dealing with. We managed to get through the next few months. I had my surgery. My husband got a new job, but we're still paying medical bills 6 months later from that surgery. My husband's new job hires as independent contractors, and since I'm already a sole proprietor owning a business here in Reno, we had to go to HealthLink for our insurance. Yet again, we were faced with an array of high deductible plans. Currently, our so-called affordable plan costs us $9,000 in annual premiums, which is followed up by a $17,000 family deductible for a family of 3. And that totals $26,000 a year of out-of-pocket expenses for my family. And that means we do not go to the doctor. We do not seek any medical care unless absolutely necessary. This means that in reality, we really only have catastrophic health care because it doesn't cover any regular medical care until we pay $26,000 a year. This is not affordable health care. This is not quality, and this is not sustainable for working class families. And I just ask that we consider another way, something without high premiums and without high deductibles.
Thank you, Michelle. Any other public comments? Please feel free to use the raise hand feature on the Teams platform. Do you have any other public comments? Okay, we will move forward into the next part of our presentation and talk about next steps. And for that, I'll hand it off to Michael Gordon to talk about the next steps in this process. Thank you.
Okay, for next steps, do we have people? Hold on one second on that. We do have folks on the phone. If you want to just unmute and we'll take the first comment on the phone. If you'll just state your name, and then we will try to go through the ones that are on the phone. Sorry about that. If anyone's having technical difficulties and if you're on a phone, you can always send us your comments through our email, and I will be giving that in a few minutes through our presentation. Okay, so next steps, we will be doing public comment period. We'll be accepting public comments through December 20th, 2023. And then the plan is to submit our 1332 waiver application to the federal government by January 1st, 2024. As I mentioned, next slide. As I mentioned, there is contact information for our administrator, Stacey Weeks, for our deputy administrator, Melinda Southard, and for myself, Michael Gordon. So that's right there. You can reach us by email. You can submit comments there, or you can also submit comments through our email. It's a 1332. Hold on one second. Sorry, I had it in front of me a second ago. Yeah. And the email address for that is 1332 waiver program at dhcfp.nv.gov. Once again, 1332 waiver program at dhcfp.nv.gov. And that's also on the agenda.
Just in closing, thank you all for being here. If you have questions and you want some follow-up on anything, feel free to email us or send in your comments again in writing, and we will formally submit them with our waiver application. What we'll be doing next is summarizing all of these comments and hopefully trying to respond to them as much as we can and making adjustments to our waiver application before submission. But again, if you had comments and couldn't, for some reason, chime in, please send us those in writing. And thank you all and have a good afternoon. And I think we're adjourned. Thank you.